Hi, so today I want to share a little bit of a different video and to share some of my experiences today. So I just gave a presentation at the Alberta Hospital, which is the hospital that I was hospitalized in 2.5 years ago, that I talked about my story and the video on what it's like to be in a psychiatric hospital. But I just wanted to talk a little bit about what the experience of presenting to doctors, psychiatrists, nurses, and social workers at this hospital was like today. So I've given this presentation many times to different audiences, such as police officers, students in university, criminology students, OT students, psychology students, high school students. And the thing that always strikes me the most about these presentations is just the richness of the questions that I'm asked following the presentation that I give and following sharing my experiences with schizophrenia or schizoaffective disorder. And I think that that's where the really valuable exchanges happen, is in asking questions that people want to know more about my experience with the illness. I was so excited to present today to a group of psychiatrists, doctors, nurses, and social workers who were a part of my treatment at this very facility behind me, and who are part of the treatment of a lot of mental health patients here. I was so excited to have that first-hand exchange with them, to talk about what can be done better and to talk about how the mental health system can be improved. But I was really left very disappointed at the end of this presentation because there were no questions. I gave my story as well as another woman gave her story. And we presented all about what the Schizophrenia Society of Alberta does, and we presented the two stories, and there were no questions at the end of it, and I thought that that was so disheartening. My story in particular talks about and touches on the difficult experience that I had at this very hospital with these staff members, the very difficult experience that I had being hospitalized, and just kind of the negative experience that I had with this hospital. And so I understand that it can be really hard to hear criticism, and it can be hard to ask for constructive feedback sometimes on the job that you're doing. If you care about your job and if you care about the work that you're doing, I understand that it can be hard to ask for that constructive feedback. But I think that it's so dangerous to not ask for that kind of feedback and to not want that kind of growth within your position. I know from my first-hand experience that there's so much room for improvement in the way our mental health system operates, and so there's so much room for improvement on each person in that room today. And so to not have had any questions was, again, just really disheartening. I think kind of a dangerous aspect of hospitals and psychiatric hospitals and mental health institutions is kind of the maintenance of the status quo within these institutions. There's a hierarchy within these institutions, and I think there's a lot of room for that to be broken down a little bit. I wish that I would have been asked for feedback on how to make the experience better for patients here, and I would have said something along the lines of more collaboration is needed. There's a lot of talk around the word or the term patient-centered care, and I think that that's really important, but I think that we need to be making sure that we're actually putting that into practice. So making sure that we're listening to the experiences of patients and we're advocating for the inclusion of them within their treatment. So if you are a mental health practitioner or provider watching this video right now, I really, really want to encourage you and ask that you take the time to take into consideration the experiences of the patients that you're working with, and to listen to how their interactions with you and with the mental health care system have been and what can be done to make it better. So thanks so much for watching this video. I just wanted to take a little bit of time to share some of my thoughts and reflections on my experiences today giving this presentation, and to just share a little bit more about where I think improvements can be made in terms of communication between patients and providers within the mental health care system. So thanks so much again for watching, and have a great day. Bye.